I'm Dr. Barbara Kostick. Welcome to another session of Your Concerns in Health, the program that addresses your questions and concerns about your health and your health care. Today's topic is vitamin supplements. We'll explore the merits of taking supplements and provide some helpful advice on how to choose them and how to use them. Vitamins help regulate metabolism, help convert fat and carbohydrates into energy, and assist in forming bone and tissue. In short, vitamins are essential for life. We need all the nutrients in their proper amounts for optimum health. Since our diets most likely cannot provide all of them, nutritional supplements can fill the gaps. Most people are curious and confused about which vitamin supplements to take. There's a lot of contradictory information, and it's often difficult to understand. To help us with our discussion, we brought together a panel of experts. Dr. Stephen Curran, a family practice physician. Lorie Roffelsen, a registered dietitian and certified diabetes educator. And Anna Mazzei, also a registered dietitian and certified diabetes educator. Welcome to you all. Before we begin our discussion, let's hear what some of the people in our community think about vitamins and their value.
Vitamins are found in things we eat, things we drink, and also supplements we take, essential nutrients for health and well-being.
Vitamins are something that our bodies need and we should take, and a lot of us don't take them. And I take them periodically, but probably not as much as I should.
They help supplement your intake of food with the proper nutrients in order to maintain a healthy lifestyle.
Well, vitamins are just minerals that your body uses to do the processes that it needs to do.
Let's address some of these assumptions and misunderstandings. Starting with you, Dr. Curran, what are vitamins?
Well, vitamins are vital amines. They're organic compounds that our body needs that in most cases we can't make on our own, so we need to get from food.
What are good sources of vitamins in the vegetables? What would be some really good sources?
Well, the dark green leafy vegetables are loaded.
Okay.
And things like broccoli, and the more colorful the better. So the yellow, the orange, those are the ones that have the beta carotene in them. And the different phytochemicals are in those foods, and that's why it's important to eat. Don't just stay with green beans every meal every night, or even broccoli, even though broccoli is like the Olympian of vegetables. But to look what's in season too, because that's going to probably have the biggest bang for your buck in terms of the nutrients.
How do we determine how much vitamin is necessary?
You have the recommended daily intakes designed by the Institute of Medicine. They give us a table that tells us what the average needs are for people at different ages and different sexes. So they have done scientific studies that show what people need at different times in life.
I always wonder about how they do these scientific studies. Do they measure and give everyone so much little vitamin and then see how they react, if they feel good or don't feel good? Or how do they determine what is the necessary daily requirement?
I think it's important to know that it's a fluid process, meaning those recommended dietary allowances are frequently changing as we develop more information and knowledge in the field. And it's also important to note that those dietary allowances are often set as minimums that are required for the body to intake to prevent disease.
And they're meant for healthy people. And outside of that, there may be different recommendations for people who have problems with malabsorption or have had surgeries. They may need different intakes, and recommendations are made for those people.
It may vary by age and again by other medical conditions.
Mm-hmm.
How do we know what vitamins are in foods?
The USDA, for example, has a website that you can go to and you can type in a food, and it'll give you a extreme list of different nutrients that are in a serving of different foods. The USDA also has mypyramid.gov, where if you put in your height, your weight, your age, it'll print out for you the number of servings you need from each food group to get all the nutrients that you need. And then it goes into, you can also go through the different web pages there, and it describes the different nutrients in different foods and the different food groups. And then the best ones to select in each food group.
And vitamins come in different kinds too. There's what, fat soluble and water soluble. What does that mean? What does that mean, Anna?
Well, the water soluble vitamins are less likely to be toxic because they reach a saturation and then you would just urinate them out. But because of that also, you can't store them. You do need to have an average daily intake of those nutrients too. Whereas the fat soluble, you do store. And those are vitamins like A, D, E, and K. And we have concerns about people going over certain limits with those because those can reach toxic levels. Mm-hmm. Whereas with the water soluble, that's less likely to happen, although there could be some negative side effects. Like, for example, niacin is a B vitamin that we need for normal metabolism, and we only need a few milligrams a day. But at higher levels, doctors prescribe it for lowering cholesterol. Mm-hmm. And it can be, toxic on the liver, and it can worsen blood sugars in people who have diabetes. So, you have to be careful about thinking that more is better.
Dr. Curran, do you see vitamin toxicity in some of your patients?
On occasion. Mm-hmm. For example, with the niacin, we frequently use that as a pharmaceutical medication to treat a cholesterol problem. And it has a somewhat narrow therapeutic window. To get the real benefit, you must take much more than the recommended dietary allowance, but anything above 2,000 milligrams can occasionally result in liver problems, blood sugar problems, or other issues. So that's one example of a potential vitamin toxicity, but we also know excess of vitamin A may actually be associated with increased fracture risk. Other vitamins, folate has even been implicated. Too much folate, some studies suggest a possible increased cancer risk.
And with vitamin A, you have birth defects too.
Exactly.
You have birth defects.
So there is too much of a good thing.
Oh, yes.
There is danger in vitamins. Well, then what about these recommended daily allowances? Do they take into consideration and make sure that this minimum is way below the threshold for toxicity?
Absolutely. And a lot of, if you're, say, wanting to add a multivitamin to your diet, we usually recommend choosing one that is at those RDA levels and not in a megadose level, so you're not at risk for toxicity.
In your practice, Dr. Curran, do you see people megadosing on certain kinds of vitamins?
It doesn't appear to be as in vogue as it was perhaps years ago, but another example of overdose of vitamins, vitamin K. Many of our patients are on Coumadin, a blood thinner, and excess vitamin K may actually be very dangerous in that situation.
Yes, I do think so because I feel that if you don't take them, then you'll regret it. You'll feel that you'll need them further on in the future when you have these issues going on in your body and you wish you would have taken them because the minerals and all the vitamins all together make your health better, I believe.
I can tell you I had my vitamin D tested a while back, and when I started taking the vitamin D, it actually made me feel so much better.
If we didn't have them, we would be in extremely poor health and maybe even dead. That's how important they are. Yes.
It looks like this would be a good time to clear up some misconceptions. Lorie, are vitamin supplements approved by the FDA?
Well, vitamins are regulated by the FDA. Vitamins, minerals, herbs, botanicals all fall under the umbrella of dietary supplements. So they are regulated a little differently than prescription and over-the-counter drugs, meaning that there can sometimes be claims on dietary supplement labels that are not proven or evaluated by the FDA.
So, Anna, you can put anything on a label?
We know there's allowed claims. If they make a structure function claim like enhances immunity, they can say that this statement has not been evaluated by the FDA and it's not meant to treat, diagnose, or cure a certain condition. So they have to put a disclaimer on it. Now there are allowed health claims by the FDA, like calcium and osteoporosis, fiber and proper digestion and elimination, those kinds of things. A health statement has to have a nutrient and a disease condition to call it a health claim in the statement. So those are allowed, and there's probably 8 or 10 by the FDA that are allowed.
I think it definitely helps to read the fine print when it comes to any vitamin or supplement label. When it says may be beneficial, use that word strictly may. It is not a guarantee.
Well then, Lorie, what is the difference between FDA regulation and FDA approval? Is it something that maybe just people say, we just assume that regulated means approved and it really doesn't?
Well, drugs go through probably more of a lengthy process before they can be put on the market. So they are tested and go through maybe trials, show what they're effective for, versus dietary supplements can be put on the market without going through all of that
Scrutiny.
scrutiny.
Yeah.
Exactly.
Wow. Have you seen problems with this area, with patients coming in thinking that they're getting something safe and it's really caused problems for them on it?
Well, that product that was for weight loss, I think it's called Mahung or Ephedra. People were having side effects. Were having cardiac events and being admitted to the hospital because of taking that supplement for weight loss, and it was in different kinds of teas and things. And the FDA was getting reports on that ingredient, and then it took several years to get it off the market.
I want to ask a little bit about when you read a label and it says it has this much vitamin in it and this, does it really have that? Is that certified by the FDA that it has that amount of vitamins, or is that just what the manufacturer puts on it? And
Right.
like we have to attest to things now, but we don't have to show any proof of it.
Well, you're right. The FDA does not check the product, but a company can hire an outside organization like the USP, United States Pharmacopoeia, or Consumer Labs, or NSF International, to evaluate the product for its purity, strength, safety, and dissolvability. And actually, I don't want to say safety. It's really the purity and strength and the dissolvability of the product.
Because the safety of a vitamin and how much you take depends
Right.
on the particular person too, right?
Right.
As you said earlier, you said that there was something about if you were taking Coumadin, you didn't want to take vitamin K at all. And I would think different age groups need different drugs. What about different people in different diets? Do they need different things too?
Well, I think it's important to note certain diets, for example, strict vegetarians are often deficient in vitamin B12. Women of childbearing years often need to make sure that they're up on their folic acid levels.
So do you think if you think that you need a multivite because you're not taking enough food, the right kinds of foods, do you make a multivite that fits you, or should you just go out and take a blank multivite?
Well, I'm always an advocate of trying to get it from the foods, and maybe look first at your eating pattern and see where you maybe can improve and try to incorporate foods that are food sources of those vitamins and minerals. And generally, if we're advocates of just eating a good variety of foods, so you kind of make sure you cover all your bases and all your vitamins and minerals, rather than just eating bananas or one particular food.
I would have to agree with you. I don't think that point can be overstressed. There's a perception that vitamins sometimes act as a good insurance policy, that when your diet is inadequate, that it's the next best thing. But in reality, I think a vitamin supplement is really a distant substitute, for a good diet.
It's a crutch. It's almost like a crutch to people.
And it's one size fits all. So what you should really do is maybe sit down and write out what you eat and then check the pyramid and see how close you are to the pyramid. Would that be a good plan?
It's too simple to go back to basics for people. They want something fancier, I think. So I just think that getting back to basics, eating a variety of food, it's logical that you need to eat from a variety of food to get all the nutrients that you need. Then you can say, depending on where you're at in your life, and keeping up with your physician and going to have physicals, you can maybe capture a time in your life where you might need to have a supplement of some sort. But I think that you just want to make the consumer wary that there are the downsides to supplementation if it's in excess, if it interacts with their medications, if it delays the need for the real treatment that works for a condition. You surely don't want to give up medication and start taking vitamins without talking to your doctor.
And it may be an added cost, an additional medicine that you're buying that is not necessary. And it is a big industry, the dietary supplement industry, because people believe these claims that this additional supplement that they take daily is going to make a difference in their health.
Right. And delay care, delay proper care.
Well, the information out there is very confusing to patients and physicians alike. But it's our job as primary care physicians, we have to sift through that information and try to determine really what a patient needs are, and it is very complicated. These ladies would agree with me, designing a ideal diet is as much an art form as it is a science, to get all the micronutrients you need, the rainbow fruits and vegetables. It's very difficult. So vitamin supplementation may have a role, but it should be thought of as a well, the icing on the cake, or maybe that's a bad example. Maybe
it could be a carrot cake. We'll make it a carrot cake.
Right.
Okay. Well, what do you see when you interview your patients for their diets? So come on, you're two nutritionists. You've seen how many patients a year? What are the common mistakes that they make where they don't get their nutrients?
They lacking in fruits and vegetables usually.
Is it fruits and vegetables?
Fruits and vegetables. They don't realize the quantity that that are recommended to eat in terms of the serving sizes.
And there's certain ethnic groups which probably avoid milk products to a large extent, so they may be lacking in calcium or vitamin D sources.
Right. And then what I see is when people say that they eat their vegetables, their idea of vegetables are, 4 vegetables: potatoes, peas, carrots, and corn.
Ketchup, parsley.
Oh, ketchup and parsley. Oh, good. Is it, if the vegetables ripen, do they have more nutrients in them than if they're unripe?
Definitely, if they're overripe, they may be less.
A little too far along.
Right.
Yeah,
Yeah.
Right.
And be lacking maybe in some of those nutrients. So, of course, that's one of the reasons you're encouraged to try to eat locally grown vegetables, which haven't traveled a long distance and have started to lose their nutrients.
What about the idea that if one vitamin is good, 2 are better?
Well, I think that's a common misconception that that if 1 is good, then 2 must be better, or 4, why not 4? But there's definitely toxicities that can be associated with too many vitamins. Excess of vitamin A, excess of folate, excess of vitamin D, others may all be potentially hazardous.
Well, what about natural? Isn't that another myth?
Yeah, I think that consumers sometimes think because a dietary supplement is natural, say a plant or root, that it is safe to take in a supplement form. And the concern there is that there may be an interaction that's potentially going to happen between other medications that person is on, or the amount of there could be a toxic amount of that supplement because you've taken it from a natural state and put it in a supplement form where it may be more concentrated.
When we come back, we'll discuss the importance of your diet and how to properly use vitamin supplements to maintain optimum health.
Doctors prescribe them, or kids' commercials, gummy bear vitamins, Flintstone vitamins. And yeah, ever since I was little, I've been taking those Flintstones vitamins, and they're good, and they taste good.
Fruit. What a tasty treat. Fruits packed with potassium and other nutrients can help keep your heart pumping strong during the game. And they give you energy back so you can take on the next activity. Can your food do that? Run, throw, think, eat better. Find out more at smallstep.gov.
You were not created in 2 dimensions. You are a complex construction of muscle and bone, blood vessels and synapses. Seeing your inner workings takes some equally sophisticated technology. That's why at Washington Hospital Outpatient Imaging Center, we've invested in the most advanced digital imaging equipment so we can diagnose you quickly and accurately. We see the whole you, to treat the whole you. Go to WHHS.com to learn more.
Washington on Wheels brings health services to people in the community who otherwise wouldn't have access to quality health care. And take it from us, there's nothing more frustrating than being denied access. To find out when Washington on Wheels is pulling into your community, go to our website.
Well, vitamin D, if you live in an area where you don't get a lot of sunshine, or you're indoors all the time, you may be missing out on some important vitamins there. Vitamin C may help you reduce colds, tendency to colds.
The most important for me are, I take a multiple vitamin that has everything in it, iron, vitamin C, I take as a supplement in addition, and also in addition I take fish oil for cardiac health.
It depends on your place in life. Currently, I'm trying to get pregnant, so I'm taking folic acid because I'm a woman during the childbearing years. So it depends on how old you are as to what's important for you.
Wow, I don't really know. I wouldn't know where to start to say which are the most important. I have a feeling that they're kind of all necessary, right?
There are lots of products out there that are marked as dietary supplements, including minerals, vitamins, botanicals, and herbs. In fact, it's a $25 billion industry. Well, who really needs these supplements? We've talked about it, and we think good diet's important. What do you think, Lorie?
There are very few supplements that are recommended probably broadly by organizations. One I can think of is omega-3 fats, which the American Heart Association does have recommendations for. They don't have recommendations for supplementing antioxidants, coenzyme Q10, or other supplements which are out there kind of touted as having heart healthy benefits.
Wow. Dr. Curran, do you recommend any vitamins for your patients to prevent heart disease?
In the old days, we used to think about vitamin E as one potential supplement, but there's been quite a turnabout on that. Mm-hmm. We no longer recommend vitamin E. In fact, I can't really point towards any one vitamin or supplement as being clearly beneficial, with the possible exception of the omega-3 fatty acids or fish oil. Mm-hmm. Still preferable to eat fish at least twice a week, but when in doubt, a supplement may be in order.
And then what about different populations? Anna, what do you do with the elderly? Are there certain vitamins that they might need that they?
Well, for a number of reasons, the elderly might be at risk for deficiency. As you get older, digestion and metabolism may not be the same. Your food intake may not be the same either. Economic reasons, you may not, purchase the correct amounts of foods. Dentition might be not the same. You can't chew as well, and so forth. So there's a number of reasons why they're at greater risk, and one of the ones that we are mostly concerned about, or a couple, is the vitamin D and bone health. And some studies have shown that higher levels than are recommended right now show that reduce the incidence of falls by about 20%. The other one is B12, which is only found really in animal products, and so they can't really get the B12 out of food as well as they did when they were younger. Yeah. So a supplement might be in order in that case. Probably takes quite a while for it to show up, but a B12 deficiency shows up in anemia and also with irreversible nerve damage.
Well, and it's one of the screening tests we do for people when they have memory loss is we do check their B12 level. What about you, Dr. Curran? I'll bet in the old days you even gave out B12 shots.
In the old days, it was good for what ailed you. But it's very rare that vitamin B12 shot is actually required anymore.
Well, what about patients with specific problems like gastric bypass?
Well, those with gastric bypass are often vitamin B12 deficient, but that's something we can test for with their blood. Mm-hmm. And supplement is necessary with either injections or sublingual medication.
Yes, and so that brings up a whole new point about how vitamins are delivered nowadays. Yeah, I know we want to get them in our diet, but you can get them in little gummy products now, and you can get them in aerosol sublingual products and capsules, and I guess you have to be careful what's in these vitamins too, don't you, for certain people with allergies or different dietary problems?
They'd have to look at the ingredient list to see what other non-active ingredients are added to the product. They could call the manufacturer too, because by law they have to have where they are located and a number you can contact. Especially if you have a side effect from a supplement, they would want you to call them and tell them.
Now, let's go back to vitamin D, because that seems to be a really hot item right now. It seems like different vitamins go in and out of style, and E's out, D's in, right?
I call vitamin D the darling child of the supplement world right now, but there is some good emerging science that suggests it's deficient in much of the population. For example, in the United States, between, if you draw a line from Los Angeles to Atlanta, many of the folks north of that line are vitamin D deficient, particularly the elderly, and we know that can be associated with increased risk for fractures from falls, and some suggestion of evidence of possible links with other diseases.
Well, and I think the recommendations of vitamin D, as well as some of the other vitamins, is turning into a moving target, isn't it? I mean, we have to stay up on it every couple of years to make sure it hasn't changed. When we started out, I was telling people that they need to take 400 units of vitamin D, and now it's up to what, 800, 1,200, and people are taking 2,000. And is too much too much?
Well, I take 1,000 a day.
Ooh. Okay.
But
and you're a male, you know,
correct.
and that's kind of interesting to be sure to point out that men can be deficient in vitamin D as well as women.
Absolutely.
Now, do you use sunscreen products? Because some people feel those interfere with vitamin D absorption.
Well, at this point, I think the skin cancer protection trumps the vitamin D benefit, particularly if you're able to take a supplement. But that's an excellent question.
So you do use sunscreen?
Yes.
Okay, so that's why you think you need the extra vitamin D? Because
Yes.
of this, or is it because you work indoors all day?
Well, you don't have to really be in the sun that much to activate the vitamin D either. It's the recommendation maybe like 3 or 4 days a week, exposing your arms for maybe about 20 minutes, something like that, to activate the vitamin D.
Well, and I think the other thing they found in research is that as you get older, you don't activate as well
Right,
either.
and that's right. And as you get older, that's why we're saying
Mm-hmm.
that those recommendations are changing. I mean, that's why the USDA and the Institute of Medicine, study the science, and they come up with new recommendations every maybe 10 years. Dietary guidelines come out every 10 years.
Well, we didn't talk too much about, in the previous segment, about vitamin C and preventing colds. Anybody have anything to say about that? Does vitamin C prevent colds?
Well, the studies have shown that it doesn't prevent colds.
It does not?
It does not.
Okay.
Although there has been products out there that say that they do, and they were called upon by the FTC in the last couple of years to withdraw their product because they were making claims that it cured a common cold.
I think that's one of the problems that we do with ourselves, is that we think because we read that it can help the disease, so we intuitively think it might prevent the disease, so we take more of it. Does that make sense to you guys? Do you see that in your patients that you treat, that they tend to go for, they think it's going to cause primary prevention instead of just secondary prevention?
Some studies, may look at, say, antioxidants in a population that already have a disease, and so, there may not be evidence that if someone who doesn't have the disease takes it, it's going to have that preventative effect that they're hoping for.
So we saw that with that vitamin E study, right, previously, that they thought, so people would take it thinking they would prevent heart disease because they thought it helped if you had heart disease. Turned out it didn't even do that, though, right?
Correct. I mean, certain studies may show a vitamin deficiency clearly linked with a certain disease, but it doesn't necessarily follow that vitamin supplementation treats that problem or prevents a disease.
So we have to, just like we learned about the labels, you've got to read the fine print in all these little studies, right?
Well, they showed that, dietary intake studies showed that, for example, high intake of the carotenoids, or, the beta-carotene, lower your risk of lung cancer. But when they did it with supplements, they showed an increase in lung cancer in smokers. So, and now, people are really shying away from recommending that as an antioxidant.
So when you recommend vitamin supplements, how do you tell your patients what particular brands or type to use? Any recommendations? Not brand names, but do you tell them to look for certain things?
Usually, I would direct them to look for an approval stamp, like from the USP, which is an organization that looks at the product purity, quality, that they have good manufacturing processes according to the FDA. And they have a website, and you can look at that website and look at what vitamin companies participate in their program. There's also Consumer Lab, which Anna mentioned, and the NSF. So there are organizations that do look at quality of vitamin products rather than recommend a particular brand. And you can also maybe ask your physician if they recommend a particular brand that they think is a good quality.
And then not much more than 100% of the RDA. And then again, if they have a single nutrient need, like we talked about vitamin D, calcium, that type of thing, and how much to look for on that they might need.
And speaking about, we spent a lot of time talking about vitamins and should we take multivitamins or should we take, specific vitamins, but vitamins aren't the whole story about health, are they? What else? What else do we need about having good health besides vitamins?
I definitely think that people need to look at their whole lifestyle and not just focus in on taking vitamins and thinking that's going to be the cure for all their ails and good health and longevity and quality of life, because proper sleep, stress management, activity, exercise is huge. If we talk about what people don't get, it's activity. And, avoiding smoking, not too much alcohol, all those factors end up playing a role in reducing your risk of diseases and improving your quality of life.
And that's why we would take vitamins anyway, right?
Absolutely.
It's part of a whole package if you needed it.
So it's a package. Well, thank you all for participating in our discussion and for offering valuable insights into the use and misuse of vitamin supplements. Thanks for watching this session of Your Concerns in Health. For more information on the uses and effects of vitamin supplements, visit Washington Hospital's website, whhs.com, or these following websites: